As a healthcare provider, you will address the needs of patients across different age groups and developmental stages. All members of the interdisciplinary healthcare team must receive education and training and demonstrate competency in age-specific care. Nurses play a big role in this plan. The AORN Journal has noted that, as healers, we take courses in age-specific competencies and diversity to better prepare us to minister to the people who come to us for care. Each age group has different physiological and psychological needs, so you must plan your care accordingly. This is important for several reasons. First, such demonstration validates the knowledge and skills of staff. Second, staff competency contributes to the quality of patient and family services. And finally, the Joint Commission mandates that age-specific competency be assessed on an ongoing basis and that the findings of such assessments are documented. Surveyors will look for proof that staff members are competent to care for their patients. This evidence-based video will identify common age-specific groups seen in the healthcare setting and what special concerns you'll need to know within each group. These age groups are neonate, infant, toddler, preschool, school age, adolescent, young adult, adult middle age, and later adult geriatric. We'll also show you case scenarios to illustrate important issues to consider when planning appropriate age-specific care and identifying age-specific competencies. First, let's start with an early stage of development, the neonate. When caring for neonates, keep the following standards in mind. A neonate's skin is delicate and easily injured, and the umbilical stump is healing. The neonate should be handled gently and observed for jaundice, and the cord stump should be cared for. When assessing the respiratory system, remember neonates breathe through their noses. Watch for abnormal signs such as retraction of accessory respiratory muscles, stridor, grunting, wheezing, nasal flaring, asymmetrical chest movement, and crackles or rhonchi after day 1 of life, suction excess secretions. Verify that the neonate has adequate sucking, swallowing, gag, and cough reflexes. Verify the presence of bowel sounds before starting enteral feedings. Support the head and neck when moving or carrying the neonate and protect the fontanel areas from injury. A neonate cannot support the weight of his or her head. Look for signs of increased intracranial pressure, usually characterized by bulging fontanels. Sunken fontanels indicate dehydration. Anterior and posterior fontanels have not yet ossified. Monitor the neonate's body temperature and maintain an environment that keeps it within normal limits. The neonate's nervous system is immature. Since the neonate's skin is thin and has very little subcutaneous fat, they are not able to regulate body temperature efficiently. Provide gentle, tactile stimulation and teach parents to do the same. The neonate should be held, rocked, and comforted. Check that the neonate's primary and tendon reflexes are present and that they respond to stimuli. Keep accurate intake and output, or I&O records. The neonate should void within the first 24 hours of life. Monitor his or her ability to receive adequate nutrition. Teach the parents how to bottle feed or breastfeed the baby appropriately. Monitor fluid, electrolyte, and acid-base balance. Wash your hands before and after taking care of the neonate and teach the parents to do the same. Avoid exposing the neonate to infections. The neonate has passive immunity from his or her mother that only lasts for a few weeks to months after birth. Never leave the neonate alone unless he or she is in a crib with the sides up and locked in place. Assess the parent's knowledge of and comfort level with caring for the neonate. Provide family education and referrals as needed. Now that you know the vital signs and recommendations for appropriate care of neonates, here are the vital signs for the next age group, infants.
This is 4-month-old Melanie. She came into the EW with a severe upper respiratory infection and a 101.5 degree temperature. I just finished checking her vital signs and documenting them. Her respiratory rate is a little high for somebody of her age range. It's 56 beats per minute.
Okay, what do her lungs sound like?
I heard crackles in the bases of both of her lungs.
I'd like to take a listen. I'll put in an order for aerosol therapy. Let's continue to monitor her breathing and temperature. Let me know if her condition changes at all, and I'd like to admit her for observation.
As you saw in this scenario, it is important to check that an infant's vital signs are within normal limits, depending on their age and weight. The nurse noted that the infant's temperature was high and that there was a presence of abnormal breath sounds. When providing care for an infant, here are more key points to remember. Auscultate heart and lungs and note any abnormalities. Assess skin color and peripheral pulses. For the first few months of life, infants breathe through their noses. Avoid applying clothing or dressing that are tight and constrict the diaphragm. Be especially careful to monitor the infant's body temperature, as sweat glands have only minimal ability to function in the first few months of life. Keep the environment at an appropriate temperature as well. Protect the fontanelles from injury. They don't close until the baby is 16 to 18 months old. Monitor the infant's growth and development, as the infant's central nervous system must be stimulated for proper growth and development. Comfort the infant by holding, rocking, and offering appropriate stimulation. This can help them to recognize voices and reach for objects. The infant's parents should be involved in planning and providing care. The infant's parents should be allowed to stay with the infant. The infant is in the oral development phase. Sucking is a source of satisfaction. The infant explores the world by putting objects in his or her mouth. This can be a real safety issue if the object is poisonous or is swallowed and obstructs the airway. Provide a safe environment. The infant has little or no concept of danger. Protect him or her from falls, bumping into tables or other objects, and other injuries. At about age 6 to 8 months, the infant's greatest fear is separation from parents. The infant develops a fear of strangers at about 8 months of age. Stimulate the intellectual development. Provide large, brightly colored objects such as musical toys, mirrors, mobiles, and rattles. Part of age-specific competency is being able to appropriately assess pain in patients of different age groups. When it comes to pain management for infants, instead of verbal cues, you'll need to evaluate an infant's cry. His or her parents should be able to help distinguish between a cry of hunger, a cry for a diaper change, and a cry of pain. Now that you're familiar with the traits of an infant, we'll move on to the toddler stage. Toddlers are very mobile. Pay careful attention to the following points. Expect the toddler to be able to walk alone by 15 months and run by about 2 years of age. Be aware that the toddler has a limited ability to tell you what he or she wants and needs. Remember that he or she needs about 10 to 12 hours of sleep every night, as well as a daytime nap. Realize that the toddler may have difficulty sleeping or suffer from nightmares while hospitalized. Know that the toddler can usually feed him or herself independently by 3 years of age. Be alert to the possibility of dehydration, as about 60% of the toddler's body weight is fluid. Monitor I&O. Encourage parents to stay with the toddler as much as possible and to take part, as appropriate, in his or her care. Be aware that daytime bladder control is achieved by about 3 years of age. Give the toddler the opportunity to have some control over what happens to him or her as the toddler is beginning to identify a sense of self. Give the toddler brief, simple explanations in words that he or she can understand. Give only one direction at a time and set limits gently but firmly. Never shame the toddler or make him or her feel guilty. Allow the child to handle equipment whenever possible, or let them use a doll to role play what will happen during procedures. Always make sure that you are at the toddler's eye level when you speak to him or her. Along with all of these considerations for toddlers, you need to be competent in assessing their pain. Keep in mind that toddlers may be able to say hurt or boo-boo or point to where it hurts. You can also look to their parents for help with interpreting the child's verbal and nonverbal cues. Now that we know some of the characteristics of a toddler, let's take a look at how to put these principles into practice. Here is an example of how to provide appropriate care for a toddler while drawing blood.
Hi, Nicole. How are you feeling today?
Thank God.
No, what's the matter?
I don't like socks.
You don't? You know what? I don't like them either.
Me neither.
And what's your bear's name?
Snoopy.
Snoopy? Let's take some blood from Snoopy. Can we do that? First, I'm going to put a tourniquet on Snoopy's arm. It's going to be a little tight. Now, I'm going to use the small needle because his arm's smaller than mine, okay? It's just going to be a little pinch. All right? Okay. Now, see how still Snoopy's holding? Okay. All done. Ain't doing a good job? Snoopy did a good job. Snoopy gets hot. Good job. Okay, are you ready? Yeah. All right.
Did you notice how the nurse in the scene took into consideration that she was dealing with a toddler? She made eye contact with the child, used simple language, and used a doll to role play what the procedure would be like so the child could understand. Now let's discuss the age-specific competencies required for preschool-age children. The preschooler needs about 1,200 to 1,800 calories, 30 grams of protein, and 10 milligrams of iron every day. Give the preschooler a good deal of praise and encouragement as he or she often feels guilty for making mistakes. Be aware that serious illness or injury may cause the preschooler to regress in behavior. Recognize that the preschooler likes to play with others and may have imaginary friends. He or she imitates the behavior of adults. Answer questions quickly and honestly, and remember the preschooler is very interested in knowing why things are being done to him or her. Remember that preschoolers are very literal. When giving explanations, do not use any abstract statements. Keep in mind that a preschooler's attention span is limited. Realize that the preschooler generally needs a nightlight in his or her room. Encourage parents to stay with the child as much as possible and participate, as appropriate, in the child's care. Allow the child to have favorite toys or belongings, such as a blanket, with him or her. Now that you've learned attributes of preschool-aged patients, let's examine a new set of competencies and take a look at school-aged children. Be prepared for growth spurts to occur during this age, usually in spring and autumn. Recognize that having friends, usually of the same gender, becomes very important. Remember that school-age children need ample praise and encouragement. Allow him or her to participate in decision-making as much as possible. Explain procedures and why they are necessary in simple terms. Keep in mind that school-age children can describe their signs and symptoms. Moving to the adolescent age group, it's important to know during care delivery that this age group is experiencing many physical and emotional changes. Their vital signs are now within normal adult ranges. Be sensitive to the fact that adolescents are extremely conscious of their body. They are very worried about perceived flaws in their appearance. Remember that adolescents need opportunities to interact and socialize with other adolescents. Keep in mind that adolescents often question or rebel against authority figures. Note that suicide is the third highest cause of death among adolescents. Be sure to involve adolescents in their care and allow them to participate in decision-making. Give adolescents a sense of control over what is happening to them. Set limits firmly when necessary, and be sure to respect their privacy and opinions. Always avoid being judgmental.
Hi there, I'm Dan. How are you today?
Fine, thanks.
Good. Today I'd like to talk about the kinds of foods you like to eat and make some suggestions to keep you healthy and well. Sound okay?
Sure, I like pizza and chips and soda.
I like pizza too. And although those foods are high in fat and calories, they aren't harmful if you eat them in small portions. Tell me, what do you like to put on your pizza?
Pepperoni.
Well, the next time you order a slice of pizza, try vegetables as a topping instead of pepperoni. You like vegetables?
Yeah, they're good, but can I still have the chips?
Well, why not try a side salad instead? You know, you can still eat the foods you like, but it's important to balance them with more nutritious ones, like vegetables, to give our bodies the nutrients they need for energy.
The nurse in this scene had some important things to consider with his adolescent patient. He handled the discussion about weight and nutrition with care and even empathized with the patient. It's important to also note that adolescents can be resistant to change, and you'll need to exercise patience when making suggestions to them. The next age range, young adult, covers a spectrum of ages ranging from 19 to 44 years of age. The young adult concentrates on achieving career and interpersonal goals. The young adult has many responsibilities, often including work, marriage, and child rearing. The major fears of the young adult include loss of independence, being separated from their spouse, significant other, or children, and fear of losing a job in the event of illness or injury. Treat young adults with respect. They have the right to make decisions about their care and treatment. Don't be judgmental and support them even if they make decisions that you might not make. For example, refusing chemotherapy or pain medication. Transitioning through young adulthood to adulthood and middle age raises a new set of health and wellness concerns. Realize that middle-aged adults face the possibility of deteriorating health. Encourage visits from significant others. Respect their decisions and allow them as much control over their care as possible. Note that women go through menopause. Keep in mind that the amount of subcutaneous tissue begins to decrease and the skin begins to dry because of the decrease in the activity of sebaceous glands. Assess skin for dryness and for skin turgor. Encourage adequate hydration and use lotion to alleviate dryness. Blood vessel elasticity begins to decrease and cholesterol begins to rise. Bone density starts to lessen and osteoporosis becomes evident. Middle-aged adults experience vision changes. Their ability to hear high-pitched sounds decreases. The final age-specific care group examines the later adulthood and geriatric stages. As with all the age groups we have discussed, this final group has their own unique traits, especially when it comes to pain. For example, older adults experience a decrease in their neurons. Therefore, they may experience pain differently from younger or middle-aged adults. Ask them what their discomfort feels like. If you only use the word pain, you may not get the information you need. Ask older adults to tell you how they feel and to describe what is bothering them. Let's take a look at some other concerns for this age group. Keep in mind that cardiac output decreases, heart valves thicken, and the heart is less efficient. Monitor cardiovascular status carefully. Blood vessels are more easily injured. Note that thin skin and decreased subcutaneous tissue make older adults susceptible to temperature changes. They become cold easily, so protect patients from extremes of temperature. The muscles of respiration begin to atrophy, and lung tissue is less elastic. Vital capacity is decreased. The patient should be given plenty of opportunities for rest between activities and procedures. Remember, elderly patients' bones are easily broken. Help them to change positions and to ambulate slowly and gently. Note that blood flow and oxygen to the brain is reduced. Remember that while memory is less efficient, confusion is not normal. Realize that the geriatric patient may have decreased ability to hear, especially high-pitched sounds. Note that vision begins to deteriorate and cataracts often develop. Be aware that older adults may need eyeglasses, hearing aids, and dentures. Older adults often lose teeth. Speak to the patient slowly and avoid high-pitched tones. Note that healing is delayed because the immune system is not as efficient. Remember that there is a delay in the emptying of the stomach and esophagus. Digestion and drug absorption are delayed, and heartburn and esophageal reflux can occur. Keep in mind that elderly patients often do better with small, frequent feedings in place of 3 large meals. Note that bone marrow function decreases. The patient's complete blood count, hemoglobin, and hematocrit should be monitored. Monitor I&O. Older patients dehydrate easily. Monitor and protect from infections, as healing may be delayed. Monitor wound healing carefully. Treat the geriatric patient with respect. Do not call them honey or sweetie, or treat them as if they're children. Advanced age does not mean that the patient is not capable of making decisions and being involved in his or her care.
Hi.
I'm Mary Simmons.
Hi, Mary.
What's your name?
My name is Masha Meringue.
Okay. Great, so why are you here today?
I have a very bad cough.
And how long have you had it?
A little over 2 days. My grandson came to visit me, and he had a bad cold. And
Okay, have you had a fever?
I believe, yes, I have.
Okay, and is your throat sore?
Very, very
Okay.
sore.
Well, I'm going to have a look at your throat.
Okay.
In this scenario, the nurse remained at eye level with the patient and spoke clearly, slowly, and in a low-pitched tone. She was careful to treat the geriatric patient with respect. As we mentioned earlier, part of age-specific competency is being able to appropriately assess pain in patients of different age groups. This also includes being aware of the correct dosages for analgesics across the age spectrum. Remember that infants, young children, and geriatric patients generally require smaller doses of pain medication than young and middle-aged adults. These groups may also be more susceptible to the side effects of medication. The following points are critical to age-specific competency when administering IV fluids. Be sure to select the appropriately sized insertion needle for the specific age groups. Know the normal rate of infusion for various illnesses and injuries in specific age groups and identify patients at particular risk for fluid overload. Be aware that some age groups may need the IV site immobilized due to confusion. Young children, for example, may not understand why the needle is in place. Protect the skin from injury. Older adult skin is especially prone to injury, bruising, and breakdown. The same age-specific safety concerns that affect the assessment and management of pain and IV fluid administration also affect medication administration. The traditional 5 rights of medication administration guide age-specific competency medication management. The right patient. In addition to verifying the patient's name by checking the wristband, review the age-specific characteristics of the patient receiving medication. Recognize that the age and physiology of the patient affects all aspects of a medication's impact on him or her. The right time. Follow the time recommendations prescribed by the physician. It is also important to know how the time of administration affects a medication's effectiveness for various age groups. The right medication. Some medications are contraindicated for infants and children or elderly adults. Know what medications are appropriate for specific age groups, as well as normal range of dosage, contraindications, and side effects. The right dose. Although there are many medications that are given to both children and adults, the dosage varies considerably depending on the age and, in some cases, the weight of patients. The right route. There are sometimes restrictions on the route of administration depending on the age, physical development, and weight of patients. Safety issues are part of every aspect of age-specific care. Whether it be administering medications, assessing pain, or ensuring adequate nutrition, safety precautions must be part of the plan of care. In addition to the issues previously mentioned, the following are some of the areas that Joint Commission surveyors assess as part of age-specific competency: skin care, positioning, ambulation and patient transfers, and activities of daily living. In the event of a terrorist attack or natural disaster such as a hurricane, flood, or blizzard, be prepared to provide emergency care to patients of many different ages. As organizations formulate their emergency preparedness plans, there should be evidence that age-specific concerns are incorporated into programs. Some points to consider include the following: a mechanism to identify patients and locate family members should be identified. Staff must be able to recognize signs and symptoms of bioterrorism agents and how these signs and symptoms appear in various age groups. In the event of a natural disaster, be prepared for the most common injuries and illnesses that occur as a result of the event. The delivery of safe and appropriate care to patients of all ages is a priority for all healthcare organizations. The Joint Commission mandates that staff members receive ongoing education and training about age-specific care and that such education and training is documented. The Joint Commission also mandates that staff members demonstrate competency in the care of age-specific populations and that such competency is documented. All staff members are obligated to apply their age-specific knowledge and skills for the well-being of their patients.